Hi, I'm Sam Barke. I'm a sports doctor and orthopaedic surgeon in London, but during COVID-19 I've been redeployed to work in an intensive care unit looking after some of the most unwell COVID patients. I'm Medical Director of Return2Play, a sports medicine company that aims to improve the standard of care in grassroots sports, particularly in schools. During COVID-19 I've reflected regularly on my career path, particularly after days of high stress, and asked myself, if I could turn back the clock, would I do it again? I know many colleagues have been asking themselves similar questions. Indeed, it's quite a common coffee room discussion. So how did I get here? Being a doctor wasn't a childhood dream for me. As a teenager, I was pretty sure I wanted to go into the financial world. I was lucky to go to a school that had a good careers programme, and as part of that, we had to do a minimum of 2 weeks experience, and importantly for me, in 2 varying professions. I sorted a week in the city and it was okay, but then wasn't sure what to do with the second week. Somehow the subject came up at a dinner party my parents were at, and a family friend, an orthopaedic surgeon, suggested that I should consider medicine and offered me a week shadowing with his team. I accepted the offer, loved the week, and left having decided that I was going to apply for medical school. I trained in London and then did junior doctor posts in the West Midlands. In the UK, we move regularly as junior doctors in order to give us a broad experience in a variety of specialties, and I quickly realised that it was surgery that excited me. Fast pace, quick results, an art as much as a science. The rush of adrenaline at the first incision, the slick working of a team, and generally a satisfying outcome. I suppose many of the things that drew me to surgery are similar to the things that drew me to my main love outside of work, rugby. I was successful at getting a training post in general surgery in the West Midlands, but decided I wanted to return to London and would have to wait a year to apply. It was when I was on the lookout for jobs to fill the gap that the orthopaedic surgeon family friend had the second major influence on my career path. His department was looking for some juniors and he suggested I apply. I did, I got the job, loved orthopaedic surgery, and picked up a training post in London the following year. I've already mentioned my love of rugby, and it's probably that which has had the second biggest influence on my career to date. It was during the early years of orthopaedic training that I saw the opportunity to align work with rugby. I did a few sports medicine qualifications and started some work as a doctor on the sidelines of rugby matches in my spare time. For various reasons, I ended up being asked to advise some schools on how to manage concussions, an injury that has gained much coverage in recent years as we have started to appreciate the possibility of long-term harm from poor management. I realised that away from professional sport, access to good care was difficult, and wanted to find a better way of doing things. It was from that Return2Play was born in 2015. What do I care about? Well, as a doctor, I believe that everyone deserves access to high-quality healthcare, and that access should not be dependent on financial circumstances. That's probably not surprising, coming from someone who's been brought up in and worked in a country that has the National Health Service, something I'm extremely proud of. Of course, one of the many reasons people work in healthcare is because they want to look after people, and I care about caring. About being kind, about trying to understand and ease other people's suffering. This is easy to do at work, a smile to ease a patient's anxiety before an operation, taking the time to listen to their fears, holding their hand when they're scared. But being kind is something we should all try and do more often in our daily lives. And of course is something that has come into the spotlight recently, with both COVID-19 and the stresses that has put on people, and also the Black Lives Matter movement. I also care about doing things better than they have been done previously. You can always make improvements, and the fear of change should never stop us from taking the necessary steps to try and achieve that. There can be very few people who have not felt the impact of COVID-19 on their lives. So many things that we took for granted just a few months ago are now not possible, and everyone's experience of that will be personal. For me, a lot of the consequences of lockdown haven't really been felt, as I've been working so much. Obviously this in itself has impacted on my life, but not nearly in the same way as it has for many others. I often think of my brother and his wife, having to juggle their busy jobs with homeschooling 3 young children. Very difficult. With elective operating stopped early on in the crisis and no sport being played, I made myself available for redeployment and was first asked to go to the NHS Nightingale in Manchester for the first weeks of its existence. Like all Nightingale hospitals, this was in effect a field hospital, set up in a conference centre with a capacity to hold almost 800 COVID-19 patients. Fortunately, it became clear reasonably quickly that this capacity would not be needed, and I moved back to London to work on an intensive care unit in a South London hospital. My biggest takeaway from the experience will be what can be achieved when needs must. How impressive it has been to see working practices quickly conceived and implemented across all NHS hospitals in a situation that we had no blueprint for. Healthcare workers have had to adapt quickly and have been required by necessity to work out of their comfort zone and deal with situations that many of us have not felt prepared for. I felt great pride in seeing my junior colleagues, many of whom are only a year or two out of medical school, take on responsibility that is usually reserved for far more experienced doctors, and doing so with great professionalism. This is a credit to them, but also has only been possible because of flattening of hierarchy and the return of feeling truly part of a team and being supported, something that I hope will remain when this is over. While much of the work has been upsetting, and the mortality rates in intensive care is good evidence of that, it has also been rewarding. I feel hugely privileged to have watched patients talk to their families, via FaceTime of course, after weeks on a ventilator, see them take joy in eating for the first time in over a month, and clap them as they are discharged from the intensive care unit. But as hard as it has been, I also feel privileged to have been able to care for the dying, to pass on messages of love from their loved ones who aren't allowed to be by their side, to hold their hands in their last moments, and to be there to say goodbye. It has been physically tiring. Wearing PPE over 13 hours shifts would be exhausting even if you were just sitting doing nothing. But it has also been emotionally draining, and I think there will be many healthcare workers, and perhaps I will be one of them, who won't appreciate the full toll until it's over. We're starting to reopen non-emergency health services, and I'll shortly be returning to orthopaedics. It's becoming increasingly clear that there are indirect health issues that have been created from delays in access to treatment during the crisis, and it will take significant resource to try and clear that backlog and minimise the long-term impact. So what does the future hold for me? Like many people, COVID-19 has made me reassess my goals and made me want to get on with projects that I've probably been putting off. Our health has never been in greater focus, and I hope that COVID-19 will prompt people to take some responsibility for how their lifestyles may impact on their health. Prevention really is better than cure, and the way we choose to live our lives can have a profound effect on the risk of disease. I genuinely believe that improving education to children about lifestyle choices can have a long-term positive impact on the health of our nations. Of course, I see sport as playing a big part in that, and ensuring that sport is as safe as possible, so as to remove any excuse not to get involved, is something I would like to play a bigger part in. I really believe that for all the pain this crisis will have undoubtedly caused, there'll be many people who'll be saying, but I don't want to go back to the way we were before either. Whether that be personal things like spending more time with family, or wider issues like looking after the environment, addressing inequality, and properly funding healthcare. In the UK, the National Health Service is more appreciated than ever. The work healthcare professionals doing is being recognised, and we've proven that when change needs to happen, it's possible to achieve it. I very much hope that these things are remembered and remain. As I said earlier, I believe that things can always be done better and that we shouldn't fear change. COVID-19 has forced change upon us. In many ways, this makes it easier. It removes debate and the chance to make excuses. We just need to ensure that that change is directed in a way that means that when we look back in years to come, we can all agree that the world is a better place than it was before.